Can pelvic floor therapy help your bladder problems? Have you ever wondered if pelvic floor therapy could be the answer to your bladder issues? Well, it turns out that it can indeed help. Pelvic floor therapy focuses on strengthening and retraining the pelvic floor muscles, which are essential for bladder control. These muscles form a supportive hammock at the base of your pelvis, helping to manage the releases of urine. When pelvic floor muscles are weak, tight, or not working together properly, it can lead to various bladder problems. Pelvic floor physical therapy involves exercises and techniques designed to improve the function of these muscles. This therapy can be particularly beneficial for conditions like urinary incontinence, overactive bladder, and dysfunctional voiding. One of the key benefits of pelvic floor therapy is that it strengthens weak pelvic floor muscles. This is especially important for those experiencing stress urinary incontinence, where physical activities or pressure can cause leakage. By building strength in these muscles, you can help prevent those unexpected leaks. Additionally, pelvic floor therapy teaches patients how to relax overactive or tight pelvic floor muscles. This can significantly reduce the urgency and frequency of urination, often associated with an overactive bladder. Learning to coordinate these muscles with bladder function is also crucial for those dealing with dysfunctional voiding, where involuntary contractions disrupt normal urination. Clinical evidence supports the effectiveness of pelvic floor therapy. Studies have shown that biofeedback-assisted pelvic floor muscle training can improve symptoms, quality of life, and bladder function for those with dysfunctional voiding and overactive bladder symptoms. In fact, women with urinary incontinence have reported positive results as early as 6 weeks when combining pelvic floor muscle training with bladder training. Pelvic floor therapy is a non-invasive and low-risk treatment option. It can be used on its own or alongside other medical treatments. Many healthcare providers recommend it as a first-line therapy for bladder problems before considering medications or surgical options. However, it is essential to remember that results can vary from person to person. Factors such as recurrent urinary tract infections or other underlying conditions can influence outcomes. Therefore, it is crucial to have a trained physical therapist tailor the therapy based on a thorough assessment of your individual needs. From the perspective of bladder health and bladder cancer care, pelvic floor therapy can be a valuable supportive treatment. It helps maintain or restore bladder function, especially after treatments that may affect pelvic muscles or nerves. While it is not a treatment for bladder cancer itself, it can assist in managing bladder symptoms and improving overall pelvic health. In conclusion, pelvic floor therapy is an effective, evidence-based approach to managing many bladder problems. By improving the strength, coordination, and function of pelvic floor muscles, it enhances bladder control and quality of life. If you are experiencing bladder issues, consider discussing pelvic floor therapy with your healthcare provider as part of a comprehensive bladder health management plan.